When dental treatment is planned, be very sure that the cardiovascular risk factors are under control. First, we'll talk about treating a stroke survivor. First and foremost, reduce stress by establishing a good rapport. The person in the room who most understands scientifically the troubles of the patient is you, so be considerate. Avoid sedatives and tranquilizers if the initial attack was very recent, because this could alter the patient's consciousness and confuse the dentist. It would then be difficult to differentiate from the paralysis caused by the stroke itself. Next comes drug therapy. Watch out for blood thinners and antihypertensive drugs. On the day of treatment, always make sure that the patient has a value of 3 or less on the international normalized ratio to avoid excessive bleeding. Use good surgical techniques. And finally, use local hemostatic agents such as cellulose, gelatin, hemostatic collagen, tranexamic acid, or epsilon aminocaproic acid. Antihypertensive drugs such as atenolol react with the epinephrine in the local anesthetic solution, causing hypertension and a decreased heart rate. Although rare, these conditions are unpleasant and sometimes fatal. This is why epinephrine in excess of 0.04 mg should never be used in a single appointment. So if the concentration of the vasoconstrictor in your 2 ml syringe is 1:100,000, the maximum number of syringes you can use in a single appointment is 2. It's better to avoid nerve blocks because of accidental entry into the bloodstream. But if you think a nerve block is necessary, let your technique be perfect, or simply avoid a vasoconstrictor. For these kinds of situations, it is preferable to use articaine as it's more efficient compared to lignocaine. After the treatment, ask the patient to rise slowly from the dental chair. This will avoid orthostatic hypotension, which occurs due to the sudden pooling of blood into the vessels of the leg. This will lead to fainting. And finally, we have neurologic deficit. Anticipate difficulties in communication, gait, and oral function. Follow this checklist. Have you got a proper patient head position? To ensure an open airway, the patient should always be sitting upright. Have you got a powerful suction at hand? This is to evacuate water and prevent aspiration. Recommend either implants or dentures to improve chewing. Customize oral hygiene instructions as per the capability of each patient. For any restorations, focus only on issues that affect the quality of life. Keep the patient well hydrated and apply Vaseline on the lips at the start of the treatment to avoid chapping. Whatever the treatment, maximize comfort, dignity, and autonomy of the patient. Rubber dam should be avoided completely as it would obstruct the airway. For the surgical part of the treatment, rule out risk factors such as atherosclerosis, thromboembolism, vasculitis, and bleeding disorders beforehand. After the extraction, pack the socket and use an absorbable suture material. 2 very good strategies for people with swallowing problems are the chin tuck maneuver and the Mendelssohn maneuver. The chin tuck maneuver is where the chin is tucked into the chest while swallowing, which allows the epiglottis to cover the larynx. And the Mendelssohn maneuver is where the individual holds that position of swallowing where the Adam's apple is at its highest point. This is maintained for a few seconds. Practicing these regularly improves control over swallowing, and the food is directed into the food pipe instead of the windpipe. In spite of all the care we take, life is full of surprises, right? Let's say that we do encounter stroke in a clinical setting. Early detection is important. These are the few steps that we can take to properly manage such a scenario. Place the patient in an upright or a semi-reclining position on the dental chair and get an accurate assessment quickly. An easy way to remember the assessment protocol is by the acronym FAST, FAST. F for facial weakness. Ask the patient to smile. This will show any facial paralysis on either side. A is for arm weakness. Ask the patient to raise both the arms. Look for any asymmetrical movement. S is for speech problems. Ask the patient to repeat an easy sentence. Observe any defects in speech. And finally, T for time to call for help. If any of these signs seem suspicious, notify the emergency services immediately. Meanwhile, monitor vital signs such as blood pressure, oxygen saturation, body temperature, pulse rate, and respiration rate. Administer oxygen at a rate of 2 to 4 liters per minute by nasal cannula. If you see the condition worsening, administer CPR and defibrillate if possible. The risk factors for stroke are a family history, smoking, hypertension, obesity, sedentary lifestyle, and a high cholesterol value. You may not be able to control some of these, but thank God, what you can do now is under your control. A balanced diet, daily exercise, and a good sleep are the ingredients for a happy life. Love your neighbor, smile, and keep harmful habits at bay. And that's how we do it, folks. Until next time.